It's California Edition. I'm Brad Pomerance. Today we are joined by Dr. Babik Zamiri. He is a doctor, owner, proprietor of the Arthritis Medical Clinic with 3 offices in the Riverside County area. And sir, before we talk about a specific piece of legislation in which you are a supporter, I want to get a sense from you, just most generally, about the Affordable Care Act and how it's rolled out in the Inland Empire.
Hi, Brad. Thank you for having
Please.
me here. Affordable Care Act is at its infancy at this point. We have had a lot of doubts at the beginning,
right?
That, how it's going to roll out. At the beginning, it's more of in the favor of family practitioner
Right.
and general practice. At this point, the jury is still out if the specialists are going to benefit from Affordable Care Act. There are a lot of issues with it. We are hoping for the next year to see some changes in it. At this time, it's working at the infancy. And
are you seeing more patients because more people have coverage? Because we do know, whatever you think about the Affordable Care Act, that the number of Californians who are uninsured has gone down significantly.
We are not seeing more patients at this point. The reason is the coverage, although the more Californians have more insurance, but
Right.
the not many doctors are accepting. Because of the problems that with the planning of the Affordable Care Act.
Right,
at
we
this
know
point.
there's questions about the Medicaid expansion, about the various levels. Let's talk, though, about a bill that I know has been, you have been a fan of, and it deals with prescription drugs.
That's right.
I mentioned to you my dad is a pharmacist.
That's right.
I also have a wife with a chronic condition, and she needs to take drugs that are known as biologics.
That's right.
And we've really had to go through quite a mousetrap to get a lot of her drugs approved by the insurance company. It has been quite a challenge. I know that in your practice, some of the drugs that my wife needs to take, she has Crohn's, are very similar to the drugs that those with arthritis need to take. They're both autoimmune conditions. And so there's been a lot of frustration surrounding prescription drugs, both before and after the implementation of the Affordable Care Act. Talk to us most generally about the frustration, both for the patient and for the doctor.
From the patients, the problem is transparency. Patients don't know if their insurance company covers, and if they cover, how much of the drug they cover, how long do they cover, and what is the level of their co-insurance. As a doctor, we have to go through a lot of hoops and loops and fill out a lot of documentations for every patient to cover these drugs. The problem is lack of transparency. Each insurance company is very different. Each one of them have different way of dealing with these medications.
So under the current law, we'll talk about SB 1052 in a moment. If I want to find out whether my insurance company covers a drug, what do I do?
Under current law, as a consumer, you call your insurance company, get some information which are not specific at all. Most often, you get a general sense of if it is covered or not. Most consumers are not savvy, and the moment they are told that, yes, we accept these medications, they're satisfied, then they find out that, yes, it is covered, but 80% of the drug cost is on their behalf. So the information is not out there, and that's what the frustration comes.
So talk to us about SB 1052 and the drive to get this bill passed. Before we talk about whether it is going to become law, talk to us about this bill and what it hopes to do.
The whole plan is, with this bill, is to have transparency. Everybody needs to know by their insurance company if the medication, especially these pricier medications, are they approved or not? If they approve, for how long do they cover it? At the same time, everybody has to have an understanding what other insurance companies are doing. This is exactly the same as you go for car insurance. You can go and get a car insurance prices compared to other companies. But in health plans that we have at this moment, there is no comparison. You cannot compare apple to apple at this point.
So what does this bill do specifically as it relates to prescription drugs? What does it require?
So what we are hoping with this bill, every insurance company should have a standardized format, provide the level of coverage for these medications. How long do they cover? How much of it do they cover? And under what circumstances? So people can easily get to the website and get the information.
Right. It would seem to me that shouldn't I just be able to go to the insurance company, type in the drug Stelara, and it will say covered, not covered. If covered, it will provide for a 90% payment and you have a 10% copay or a $5 copay. If there's a generic, there's a generic and you can choose a generic and you'll get charged less. Is that hard?
This is as easy as that. It's a very common sense, both for the patients and for the physicians as well.
Right.
We spend a lot of money in our practices and a lot of time to cover these medications. So it is as simple as it sounds. It's not happening at this point.
So does SB 1052 require what we just described?
Absolutely. That's what it is. It mandates every insurance company, including Affordable Care Act and exchange groups,
right,
to provide this in a format that is standardized and patients can compare apple to apple.
What about for Medicaid?
Medicaid is also included. They should be able to provide this information as well.
So what did the California Medical Association say about this? What did the California Insurance Association say about this?
I
can imagine what the CMA said.
California Medical Association, I imagine there are supporters, but I'm not sure how much the insurers are supporting of it. At this point, there have been a lot of scenarios that they don't like this to pass.
But at this point, it looks like this bill is going to make it. It looks like it's going to cross the finish line. How does that make you feel?
It has been quite a battle for especially past few years. This is kind of like a finish line that
right,
you're getting closer and closer. It feels very good to have this. And I think general public, when they know, hopefully this passes, general public will know what they have that they didn't have before.
I mean, I would think in the end it would be a net win even for the insurance companies, because if the information is clear, it's clear. They can't then have some insured say, but wait, I talked to this person on this day. I mean, there's the website, it says it right here.
It's to me, it's slam dunk.
Right.
It has to be like this. And
do you have a sense as to whether other states either have passed laws like this, or is California a forerunner?
California is a forerunner, has been forerunner in many parts, even in the past, and I believe that this is also something that other states don't have.
But this was not part of the Affordable Care Act?
No.
So when do we expect the rules set out by this bill to go into effect? Or do we need regulations to be written and then it could take a couple years?
It may. We are always hoping that things happen as soon as possible, but of course, first thing is all the politicians get their act together and the laws are signed, and then of course there are regulations that they have to.
Because I do think, look, there are a lot of drugs out there, and I do think, to input that into databases, that could be a bit of a challenge.
Absolutely.
And to have a website that you have 3 insurance companies up, and it will take some time.
But as long as you are in the right direction, I think the fight has been a long fight, and we are getting close to the finish line, and it's always good to see we are getting close.
He is Dr. Babik Zamiri. My name is Brad Pomerance. I want to thank you so much for watching California Edition.